Okay, the last thing we're going to do for this patient today in regards to her foot is we're going to kinesiotape the areas that we had worked on. So what I'm going to do first is I'm going to take an alcohol wipe here and just kind of get some of that emollient off so that the tape will stick a little bit longer for this patient. The tape will typically stay on for about 2 to 3 days. You can shower with it. There's no medicine or chemical in the tape, so it's pretty safe to use on everybody. Okay? Now the way I explain how this tape seems to work is it's similar to when you have one of those nose right breathe strips on. You put the tape on and it's stretchy. You put it on with a stretch on it so that when the tape recoils it lifts the skin off of the underlying tissues. So you're trying to avoid more adhesion formation between the scar, the treatment area, and the underlying connective tissue. So while this treatment, the areas that we treated are healing, they're not likely to recoil and reattach. So we're going to put one piece of tape here on the ankle, right over that scar that we treated. And we're going to put a little bit of a stretch on the tape as we put it on the leg. This will also give her ankle a little bit of extra structural support and stability, since she does obviously have some weakness in this ankle due to her surgeries as well. And this should help facilitate some of that lymph drainage that we talked about as well. Do a couple more here. Now in this patient's case, we're doing this more for lymph drainage and swelling and to keep the scar from adhesing to the underlying tissues, more so than a structural stability type of taping. In a structural stability type of taping, we're going to follow the muscle direction, but in this case, we're not particularly focusing on that part of the treatment. So we're just trying to get this over the areas that we treated today with the scars included. And one thing you can do too is if you rub the tape, the heat will activate that adhesion a little bit better for you. Now because this patient's very flat-footed, she's lost basically all of her arch due to her surgeries, I'm also going to do an arch support tape, which generally feels really good for all plantar fasciitis, ankle, feet patients. Nice stretch on the tape here, coming up. And this will also help to anchor down some of those other anchor parts of the other tape we put on first. Good. And then lastly, we're going to put a little anchor strip. Sometimes these little ones tend to fray first. So just for the patient to have the tape on a little bit longer, we will put an anchor strip on. Now the anchor strip, we're not going to put too much of a stretch, if any, on. This isn't supposed to be therapeutic. This is just to help hold down the other pieces. You mind turning your leg in for me just a little there? Good. Good. All right, and that's it. Thank you for watching.